letters that we've all heard in conjunction with each other, but perhaps we don't fully understand. I know for myself, since I've been so removed from the concept of post-traumatic stress syndrome, I've never really given the opportunity to try to fully understand exactly what it is, until I landed an internship with the New York City Mayor's Office of Veterans Affairs. There, not only did I finally learn the definition, which according to Merriam-Webster and the New York City government, is a psychological reaction that occurs after experiencing a highly stressful event outside the range of normal human experience, but I also witnessed almost on a daily basis the individuals who had to struggle with this disease. In that, I learned that not only is it important to identify the symptoms and struggles associated with PTSD, that is only half the battle, as we need to also understand the possible treatments. The three areas in which PTSD treatment fall under are pharmaceutical, cognitive behavioral therapy, and activity counseling. Before exploring treatment options, it is important to understand that it's not just military people who go through PTSD. And also, there is no cookie-cutter model to treat PTSD, and often a holistic approach is taken, starting with medicinal. The most common drugs used to treat PTSD are referred to as serotonin reuptake inhibitors, or SSRIs. Let's break that down. According to the National Center for PTSD Online in 2015, serotonin is a hormone in the brain that controls mood and behavior, and imbalances in that can cause problems with PTSD. A reuptake inhibitor will either try to prevent more serotonin from entering the brain cycle, or will add more if the imbalance is in the opposite direction. According to the FDA Center for Drug Evaluation, as of 2015, two drugs, Zoloft and Paxil, have been approved for PTSD use. Zoloft was created, according to Zoloft Online, as of 2015, Zoloft was created in the 1970s and has had many success stories, however, has been more recently hit with a lot of nasty lawsuits. It attempts to restore normal serotonin levels in the brain. According to eMed Experts Online in 2008, Paxil was also created in the 1970s. It has the same effect as Zoloft, however, it is less intense, lower dosage, and may have to be taken for a longer period of time. Like Zoloft and Paxil, cognitive behavioral therapy focuses on the brain, but instead tries to change thinking patterns rather than chemical makeup. Cognitive behavioral therapy is an effort to change the way the patient thinks about their trauma, most commonly through what's called exposure therapy. Exposure therapy has 4 steps. First is education, trying to get the patient to learn about PTSD and set expectations for the therapy. The second is breathing. Breathing can be used during a PTSD episode to help calm down the patient. Third is real-world application, where the patient is encouraged to approach situations that in the past were avoided due to their relation to trauma. And fourth is talking through trauma, where a therapist attempts to change the way a patient owns the memory of their trauma. A qualified therapist is necessary in this step. According to the National Center of PTSD, sessions last about 90 minutes, and there are about 8 to 15 sessions per cycle. These therapists help to work to change stressful memories into positive memories. Once a patient is in the right frame of mind, this therapist may refer the patient to what's called activity counseling. There are various forms, including equine and skill therapy. According to the Equine Psychotherapy Online Journal, the purpose of equine therapy is to provide an experience to the patient that contrasts the stressful experience they've had in the past. Equine therapy usually involves horse care, horse grooming, riding horses, and jumping with horses. Safety is always a top priority, and patients often wear helmets or body gear to prevent injury. As for skill-based therapy, the idea here is to provide a distraction for PTSD patients to channel their anger through a different medium. Activities such as art, craftsmanship, sports, karate, and yoga have all been used in the past. In the movie American Sniper, directed by Clint Eastwood in 2015, Bradley Cooper portrays ex-Navy SEAL Chris Kyle, and towards the end of the movie, he is seen bringing a veteran who struggles from PTSD to a shooting range in order to try to help him cope. Sadly, one veteran he brings ultimately has a PTSD episode and takes Chris Kyle's life. It is there evident, and also in previous statements, that there is no cookie-cutter example for how to prevent and treat PTSD. Instead, we have treatments that lie on a spectrum. I also learned this summer that the burden of PTSD not only lands on the patient, but also lands on the family as well. And a solid support system is essential for getting treatment. Thank you.